Caring for people with dementia. What is dementia? What is dementia? Dementia is a permanent and progressive loss of ability to think and remember caused by damage to the brain tissue. A person with dementia experiences problems with memory, especially short-term memory, difficulty putting thoughts together and understanding concepts. They have problems with judgment. The person is not able to make good decisions. Disorientation. The person is not oriented to person, place, or time. Lastly, an ability to manage activities of daily living. Dementia versus delirium. Dementia must not be confused with delirium, which is a temporary state of confusion. There is no cure for dementia. Delirium is a symptom of underlying disorder, such as an infection or side effect of medication. Once the underlying disorder is treated or the medication is stopped, the delirium goes away. In some cases, the person may die if the underlying cause of the delirium is not identified and treated. Stages of dementia. Early stage. Begins to experience memory loss. Person is aware of memory changes, becomes fearful, anxious, or depressed. May become angry at other people. They forget where they place things. Perservation. The person with dementia perservates, which means the person with dementia may do the same thing over and over or think the same thing over and over. Stages of dementia. Middle stage. Difficulty communicating. Difficulty recognizing familiar people and things. Difficulty remembering steps necessary to complete familiar tasks. Personality changes occur. They behave differently and they may become incontinent. Late stages of dementia. Lose the ability to walk and sit independently. They become bedridden. They are no longer able to speak, swallow, or smile, totally become incontinent of urine and feces, and then death. 4 major causes of dementia. 4 of the most common types of dementia are Alzheimer's, vascular, multi-infarct, dementia, Lewy body dementia, and frontotemporal dementia. Alzheimer's disease. Alzheimer's is the most common type of dementia, accounting for more than 60% of the cases of dementia. More than 5 million people in the United States have Alzheimer's disease. If no cure is found, it is estimated that 11 to 16 million people will have the disease by the year 2050. Alzheimer's disease is caused by abnormal protein deposits in the brain tissue. Alzheimer's disease usually occurs in people older than 65 years old. However, people as young as 40 may get the disease. The risk for developing increases with age. People 85 years and older are at highest risk. Alzheimer's disease is the leading cause of death. Alzheimer's, plaques, and tangles. Conditions that put people at risk for developing vascular dementia. Peripheral vascular disease, obesity, smoking. Alzheimer's disease exact causes unknown. Researchers have identified a number of risk factors: age, family history, serious head trauma, and heart disease, hypertension, high blood pressure, high cholesterol levels, and diabetes. Vascular multi-infarct dementia. Damage to the blood vessels that supply the brain can affect the delivery of oxygen to the brain tissue. Mental functions are lost because multiple areas of the brain tissue die due to lack of adequate oxygen and nutrients. Thought to be the biggest cause of dementia in approximately 20 to 25% of the people with dementia, can coexist with other types of dementia also. Most often affects the people between the ages of 55 and 75 years old, most commonly in 70 years old. It is more common in men than women. Vascular multi-infarct dementia. The conditions that put people at risk for developing vascular dementia include a history of heart attack, hypertension, diabetes mellitus, peripheral vascular disease, transischemic attacks, obesity, smoking, high blood cholesterol levels. Symptoms may appear suddenly and they may vary from person to person depending on which areas of the brain are affected. Like Alzheimer's disease, vascular dementia is irreversible and incurable. Keeping blood pressure, blood glucose, and blood cholesterol levels within normal limits can help slow the progression. Lewy body dementia. The symptoms are a result of abnormal buildup of protein bodies in the brain. Affects thinking, movement, and memory. Develop problems controlling body movements. They tend to experience visual hallucinations, and they may be alert and capable one day and confused and need of help with ADLs the following day. Frontotemporal dementia, result of damage to the frontal and temporal lobes of the brain. Affects personality, behavior, language, and memory. Onset is between 40 and 65 years of age. Question: the main difference between dementia and delirium is that dementia is temporary. True or false? The answer is false. Delirium is a temporary state of confusion. It is a symptom of an underlying disorder, such as an infection or reaction to medication. Dementia is a chronic, permanent condition which results in the loss of function. The 4 A's of dementia. The 4 A's of dementia: amnesia, aphasia, anosmia, apraxia. The 4 A's of dementia. Amnesia, difficulty remembering, experiencing memory loss. They have short-term memory in early stages. The nursing assistant provides lots of reminders and introduces self each time and provides a structured routine. In the long-term memory loss in later stages, living in the past, easy to embarrass and upset, and validation therapy. Aphasia, difficulty speaking, expressing, receptive, and source of stress and frustration. Agnosia, difficulty recognizing information obtained through 5 senses. Unable to recognize objects or to recognize danger or people, families, friends. Apraxia, difficulty coordinating steps needed to complete the task. Difficulty with ADLs and eating. The nurse's assistant needs to do what they can, coaching, hand-over-hand cueing, and never rush the person. Behaviors associated with dementia. Types of behaviors: wandering. People with dementia may stray away from home. Always ensure that the resident and person is safe. It is very dangerous because the person is confused and disoriented. They might get lost, walk into the path of an oncoming car, drown in a body of water, such as a lake or river. They may not be dressed appropriately to be outside either. Wandering. They cannot be stopped. Many long-term care facilities have developed ways to allow residents to wander safely. Maybe on the outside they have courtyards with high fencing, allowing the resident to wander outside within safe environment of the facility. They may also wear a bracelet or anklet that will set off an alarm if the client or resident tries to lead through a doorway that leads to an unsafe area. An alarm will sound, staff members are alerted and can guide the person back to safety. Types of behaviors. Pacing. A person with dementia may pace back and forth. They may have a physical need that's not being met. For instance, a person may be hungry or need to use the bathroom, and that's the only way they can communicate it is by pacing. In response to a noisy or overstimulating environment, or they may feel scared and lost. Again, they may pace. Try to figure out what is causing the behavior and take the steps to relieve the cause of the behavior. Sometimes there's nothing to do but let the person pace. Take the person to a safe place. For instance, if they were outside a fenced area, take them to a fenced garden area and walk alongside of him or her until the behavior has run its course. Types of behavior: rummaging. They like to go through drawers, closets. They like searching for an item that he or she will never be able to find. Ask the resident or person what they are trying to find and offer help finding it. They may rummage through others' belongings or even single out a drawer in his own dresser. It may be necessary to make certain areas off limits by locking them. Special drawer or box filled with the small personal items that he can rummage through may be a good idea to keep the resident busy. Types of behavior: repetition, preservation, doing the same thing over and over. For example, a person might repeat the same phrase or question constantly. She may constantly move one piece of cloth around on a coffee table as if they were dusting. Behavior usually not physically harmful, but may be a sign that the person is just simply bored. It's very annoying to caregivers and other residents. The nurse's assistant may try to distract the person by going for a walk or even getting them involved in an activity such as looking through a magazine to help break the cycle. Delusions and hallucinations. Delusions. Delusion is a false belief. For example, a person with dementia may think he or she is the Queen of England. Don't try to correct the person. This will only upset them. It would be like someone telling you that you are not who you think you are. Try to redirect the conversation. For example, you might say to the resident, "Tell me about your day," or "Would you like to take a walk now?" Types of behaviors. Delusions and hallucinations. Hallucination is seeing, hearing, tasting, or smelling something that is not really there. It's common in people with dementia. For example, a person with dementia may tell you that there's a cat in the hallway or insects on the bed. If a person is hallucinating, reassure the person. For example, you might tell the person that you will ask the cat to leave or go through the motion of sweeping the bugs off the bed. Then gently redirect the person's attention. Types of behaviors. Agitation. Residents often become upset and excited. They may pace, shout, or strike out at caregivers or other residents. They're unable to communicate effectively with others, so they express themselves through behavior. Many things can cause agitation, including pain, an infection, an unmet physical need, for instance, hunger, a full bladder, or a lack of ability to sleep, or even a noisy environment. Types of behaviors. Catastrophic reactions. That's overreacting to something that would cause a healthy person minimal or no stress at all. For example, a resident may become agitated or begin to scream or sob loudly when you try to give them a bath. It often occurs because a person feels threatened. For example, a person may feel that his privacy is being threatened when you attempt to give him a bath. They may feel overwhelmed, or for instance, a telephone may be ringing in a room where a television is on and other people are talking. It just might be too much stimulus for a person with dementia to handle. Types of behaviors. Sundowning. Worsening of a person's behavioral symptoms in the late afternoon and evening as the sun goes down. For example, the person may become more agitated, restless, and confused in the evening hours and may have trouble getting to sleep. The exact cause is unknown. It might be brought on by fatigue, especially if the person frequently wanders, paces, or engages in other repetitious behavior of a physical nature. It occurs because the person cannot see as well in the evening hours when the sun starts to go down. Not being able to see can increase the person's confusion and agitation. Turning the lights on earlier in the evening may help the person or prevent or reduce the sundowning behavior. Types of behaviors. Inappropriate sexual behaviors. They may attempt to get into bed with a resident who is not their spouse. The resident may masturbate or undress in a public area such as the dining room. You must take measures to stop inappropriate sexual behaviors, especially if making unwelcome sexual advances toward another person. Gently but firmly lead the person back to the room and redirect attention by introducing another activity. Although OBRA specifically says that a resident of a long-term facility must be allowed to fulfill her sexual needs with another consenting resident, another resident with dementia is not able to give that consent. You must have a responsibility to protect all of the residents of the facility from unwelcome sexual advances. Question. A person with dementia may exhibit some unacceptable behaviors. Some of these behaviors may be related to which of the following? A, unable to communicate effectively. B, wanting to do their own thing. C, not understanding the policies of the facility. And D, does not understand that the actions are not allowed. Answer. A, unable to communicate effectively. An individual with dementia may act inappropriately, not realizing that what he or she is doing is unacceptable due to the loss of understanding and inability to function normally. Their attempt to communicate is misunderstood and they will act out. Responding to individuals with dementia. Managing difficult behaviors. When caring for a person with dementia who is demonstrating a particular behavior, you must use your observation skills to try and answer the following question. What is the behavior? Whom is the behavior associated with? When does the behavior occur? Where does the behavior occur? Why is the behavior occurring? Reality orientation. Many years ago, caregivers used to use a technique called reality orientation with people with dementia, based on the idea that it is important to bring the person back to the here and now by constantly orienting the person to time, place, people, and things. If the person was given enough information to stay on track, then he or she could be brought back to the present. It is useful for people who are experiencing temporary confusion that is irreversible and treatable, delirium. It is not an effective technique with dementia. A new therapy, validation therapy. It stresses the importance of acknowledging the person's reality. Rather than correcting the person, attempt to distract and redirect the conversation whenever possible. For example, change the course of the conversation by encouraging the person to talk about things from their past. Pay special attention to the words, phrases, and body language that the person uses. Better understand what the person is trying to communicate. What the person is saying may seem like nonsense to you, but there may be an important meaning behind the words. Validation therapy protects the feeling of the persons with dementia. It helps the caregiver to understand what the person with dementia is experiencing. Reality orientation versus a validation therapy. For example, if Mrs. Rivera is trying to leave the facility and she's agitated, she keeps repeating that she needs to go home and take care of her mother. A nursing assistant may say, "Don't you remember your mother died 20 years ago," which is reality therapy. Instead, the nursing assistant says, "You want to go home to see your mother? Aren't mothers wonderful? Here, sit down and tell me about your mother." Another example might be Dr. Carroll is a retired family doctor and believes that they need to go leave the facility to the hospital and deliver babies and make rounds on his patients. Reality orientation means that the nursing assistant would say, "I'm sorry, don't you remember that you're retired, that you live here? We no longer do that." Instead, validation therapy says, by leading Dr. Carroll to the nurse's station, "I bet we can find you a nurse that would love to have you make rounds with her and see the patients here." Meeting the physical needs. When helping a person with ADLs, there are several general things to do to make the task go more smoothly. To the resident, you would speak clearly in a calm tone of voice. Remind the person at each step what he or she needs to do next. Use hand gestures in addition to spoken instructions. Plan for the procedure in advance. Keep a regular schedule. Assisting with bathing. Bath time can be a very frightening time. They may not remember what a bath or shower is or why someone needs to take one. The sound of running water and the bright lights and the shiny surfaces in the tub can be very upsetting. Being naked makes a person feel exposed and vulnerable. The person may be afraid of falling. They may become agitated when they hear it's time to take a bath. If this is the case, try to avoid the word bath. Instead, say, "Let's go freshen up," or "It's time for an activity you will enjoy." If the person seems very agitated, you might start singing to the person. Singing can have a very calming effect on people with dementia. Assisting with bathing. Prepare the tub room in advance. Bath time will generally go more smoothly if you prepare it in advance. Make sure that the room is warm. Fill the tub ahead of time so that the resident doesn't become frightened by the sound of running water. Put a folded towel on the shower chair for comfort. Allow the person to wear a robe as long as possible. Consider draping a bath blanket or towel over the shoulders while bathing. The bath blanket or towel will make the person feel less exposed and also provide some warmth. Hand the person a washcloth and let the person assist as much as possible. Assisting with dressing. If they may have trouble selecting an outfit to wear. They often want to wear the same clothes every day. So what you should do is limit the number of outfits to choose from. Ask the family to purchase several different identical outfits. It can help solve these problems. To help make dressing less frustrating for the person, select articles of clothing that are simple rather than complex. Assisting with eating. It may be difficult to get the person with dementia to focus on eating at mealtime. They may forget why they are at the table and become distracted by others at the table. A quiet setting and limited food choices can also help. They may not recognize eating utensils or forget how to use them. Remind the person how to eat by placing your hand over hand and together bring the fork or spoon with the bite of food to the person's mouth. If the person cannot focus long enough to eat a proper meal, try offering the person finger foods such as sandwiches, cut up vegetables, or fruits and a stuffed potato. A plastic cup with a lid and straw or spout can help to ensure that the person drinks enough fluids. Assisting with eating. Advanced stages of dementia eventually lose the ability to eat independently. Most of the food placed in the mouth just comes right back out again. The tongue thrust motions are common in the late stages. A special syringe with a nozzle-shaped tip is used for feeding instead of a spoon. The syringe is used to place semi-liquid food further back in the mouth so that they can swallow more easily. The food is given slowly in small amounts to prevent choking. Using a feeding syringe may allow the person with advanced Alzheimer's to continue taking food by mouth for a longer period of time instead of through a feeding tube. Assisting with elimination can present many problems for the person with dementia. They may forget where the bathroom is or fail to recognize the toilet. What should you do as a nursing assistant? Sometimes a person will have an accident because he is unable to move the necessary clothing out of the way fast enough. Taking the person to the bathroom on a regular schedule, for example, every 2 hours, can help the person, and helping the person to select clothing with fasteners that are easy to manage. If a person suddenly seems to be having a lot of accidents, report this to the nurse. The person may have a medical problem such as a UTI, urinary tract infection, that needs to be addressed. Meeting emotional needs of the person with dementia. Several approaches are taken to help meet the emotional needs of a person with dementia. Reminiscence therapy, talking about pleasant times in the resident's past, or activity therapy is appropriate for the purposes of distraction. Meeting the emotional needs of a person with dementia. Activity therapy. The residents need to exercise their minds. They still can become bored. Activities must be planned for a group of residents or just for one. There are many different types of activities that a person with dementia can enjoy. Creative activities such as flower arranging, painting, and baking. Intellectual activities, for instance, looking at a book of photographs, reading the newspaper aloud together, attending a play. Social activities, hosting a tea party, going on a picnic. Physical activities, taking a walk, participating in a group exercise class. When planning an activity, take care to choose one that relates to the former interests and abilities of the person or people who will be participating in it. Caring for the person with late-stage dementia. They may be unable to walk. There will be risks of pressure sores, contractures, pneumonia. They may be unable to swallow, therefore feeding tubes may be an option depending on the advanced directives. Comfort and care, oxygen therapy, caring for someone who is dying, and care of the family, of course. Question 3. A person with dementia may feel frightened or threatened when trying to perform basic activities. What can you do as a nursing assistant to assist the person? A. Do the activity for a person. B. Break the task down into small steps. C. Ask a family to assist. D. Wait until the person is ready to assist. The answer, break the task down into small steps. Allowing the person with dementia to do as much as they possibly can on their own. It's very important. However, since they cannot remember exactly how to do things, breaking the task down into small steps and assisting the individual is the best approach. Effects of caring for the person with dementia on the caregiver. Caring for people with dementia is very important work. The difference you can make in the lives of the person with dementia as well as those of the family members is very significant. Effects of caring for the person with dementia on the caregiver. It can take its toll on the caregiver, physically and emotionally. The resident is prone to outbursts of anger and they become agitated very easily. On any given day, may be cursed at, you may be spit on, you may be slapped, hit, scratched, or pinched. The nurse assistant needs to develop a fondness for the residents, and it can be very difficult when a resident has a bad day and the affection is not returned. Behaviors can be very annoying because they are repetitious. It is not always easy to figure out what you can do or how to make this behavior stop. And until the solution is found, the behavior can really try your patience as a nursing assistant. Effects of caring for the person with dementia on the caregiver. If you feel yourself becoming overwhelmed, take a deep breath and remind yourself that the person with dementia cannot be held responsible for her actions. If you still feel angry, make sure that the person is safe and walk away. Ask a coworker or nurse for help with the person. Sometimes you may need to ask to be assigned to another resident for a while. Effects of caring for the person with dementia on the caregiver. If your frustration or anger moves you to the point of actually causing the resident physical harm, of course you can lose your job as well as all chances of future employment in the healthcare field. You may also be punished by a court of law for abuse. To provide the best care to your residents, you need to care for yourself. Question. Working with individuals with dementia can be very trying, but also rewarding. If you find yourself becoming frustrated while caring for the individual with dementia, which of the following might you do? A. Ensure the individual is safe and walk away for a moment. B. Talk to the nurse. C. Ask for reassignment for a few days. D. All of the above. Answer D. All of the above. All the choices. Ensuring the individual is safe and walking away. Talking to your nurse and asking for a short-term reassignment are all acceptable ways of dealing with the frustration that can occur when assisting individuals with dementia. It may be remembered that they cannot control what is happening to them, and if they could truly communicate with you, they would let you know that they are just frustrated.